Tēnā koutou katoa, ke te mihi e hau ki ngā tangata whenua. I hara taku toa I te toa takitahi, engari he toa taki mano e. I'd like to in particular acknowledge the children and families with whom I work who've informed my presentation, and also all the various professionals with whom I've worked, from whom I've learnt so much. Natalie Jackson gave a perfect justification for my premise, which is that we need to look after the health and well-being of every single child in this nation, if for no other reason than pure self-interest as we age. I think that should be the headline of the Welfare Working Group's premises. And I'm very glad there's been a session on children, because they are the key. As a paediatrician, I now see worse disease and more of it than 20 years ago. New Zealand hospitalisation rates for pneumonia in children are 5 to 10 times higher than those in OECD countries. Repeated or severe pneumonia can cause permanent progressive lung damage known as bronchiectasis. And the New Zealand incidence of bronchiectasis is 8 to 9 times OECD countries. And you can see here pictures of bronchiectasis. A child who's undernourished and has a chest deformity will be breathless. And if they, the more extensive bronchiectasis, which is not uncommon in our community, these people are tired, cough up a lot of phlegm, breathless, and they can become too sick to work, and they can die young in their teenage years or as young adults, and of course they'll be invalid benefit recipients before they die. Or they may be parents of young children and leave them without a parent. Streptococcal sore throats can cause rheumatic fever, which can damage heart valves. New Zealand hospitalisation rates for rheumatic fever in children are 13 times that of other OECD countries. And you'll see here a streptococcal sore throat, a normal aortic heart valve, and that has become damaged by the streptococcal toxin, and that valve just doesn't close, which means the heart's under huge strain, heart failure, again invalidism, and may die. Not quite as bad and not so long-lasting the effects, but disturbingly common, this preventable condition. A scratch or an insect bite can proceed to serious skin infection where the flesh gets infected. Hospitalisations for serious skin infections have doubled since 1994 and are double Australian rates, and you can see some examples here. A doubling of serious skin infection hospital admissions occurred from 1994 to 2000, as you can see on this graph, the years of 1990 to 2006. This indicates there must be a tipping point for child health around 1994. These health problems have complex origins. Investing more in children and improving their start will reduce long-term welfare dependency. I'd like that to be another headline of the findings of the Welfare Working Group. The depth of the problems and recommendations for solving them are addressed in this report, illustrated to the Minister of Health by the Public Health Advisory Committee, tabled last Thursday. All its recommendations are the sorts of things we're saying. What is the root cause of these preventable diseases? Poverty. That's well established in international literature and experience. A practical definition of poverty in New Zealand, and this is through my eyes as a doctor, is insufficient income for the necessities for health. These are healthcare, transport, doctor's fees, prescription costs, hospital parking, nutritious food, adequate housing which isn't crowded, damp, cold or too costly, clothing, shoes, bedding, washing and drying facilities, and all those education costs, education being so important, transport, stationery, school donations, exam fees, school trips and so on. But John's told us about the economic definition, and here I'm using the same one as he was using in the calculations in his MSD's most common figure, below 60%. This is after housing costs, and here's just that line shown from 1980 to 2008. And you'll see here the doubling rates of child poverty. And again, I'm showing you this tipping point, and let's have a look at when it was. This tipping point here was between 90 and 92, and we do know that there was a lot of changes around that time. And I contend to you that we've had a tipping point in child health and well-being outcomes as a direct result of government policy changes that drove double the number of our children into poverty, and these can have lasting ill effects. The sorts of changes which have adversely affected the incomes of low-income households with children are our low wages and relatively high taxes for the low-paid in this country compared to the highly paid.